Hello, friends. Welcome to We the Weary World. I'm Jackie Lee Howard, and today's guest is one of my most favorite human beings on the planet. Chani, as I call her, Channa Crespo, is one of my dearest friends and has so many good insights. I hope you enjoy. Please keep going. We need you. Chani.
Good morning.
You already know how much I love you, but the listeners who are just meeting Channa, I just adore this woman and trust her with everything. You have helped me in more ways than I could ever explain. And we have spent so many years of our lives supporting one another. I've watched you grow immensely, and it's been so beautiful to witness.
The feeling is mutual, FYI. We're there for each other.
We have so much to catch up on.
Yes, please start.
Through these past few months, I've been switching out medications that have been causing me all these strange symptoms. I've had nausea, I've had migraines for the first time in my life. And the pain that I was experiencing regularly exasperates the anxiety, exasperates the depression, exasperates the stress. It's all a cycle. And to overcome that, I have to work really hard. And then I'll work like a 12-hour day, not eat anything, not drink enough water. And then I come home and I have nothing left. And then it's just zone out, doom scroll, watch movies, don't speak. Thank God for therapy because I got really aware of what I was doing.
I have a constant conversation with Grace, my therapist, about that. It's a constant battle between knowing whether or not I need to change something and work on something, or if I need to change my environment. It's a constant battle, right? Like, and that's part of like the self-deprecating talk that's in my head, right? Like that's always like you're exaggerating. Like this is not as bad as you're making it. Like you need to buck up and suck it up. And all these people around you are doing it. Why can't you? All this stuff.
Therapy has given me the ability to see some things that I was doing to not help myself. I don't know. I'd be interested to hear what you think. Like, is this a lifelong thing?
I don't think so, because I've noticed in certain situations that I've started to practice things that I've never practiced in my whole life. And it's just because I did it the first time. And so the second time was less scary. And then now it's just like, now it's okay. And I can do that. The simplest thing, like ordering something and not getting what I want and telling the person that I didn't get what I want. Like I never used to tell anybody that. I was just like, whatever, like I have to suck it up and take what I got. That's not, no, I paid money for that. And now I've done it enough times where I'm like, no, this is a normal thing to do. That was always hard. And now it's not. And the same thing with people at work. Like it used to be really hard to even say anything out loud because I thought, well, karmically, this is going to get back to me. I don't think that life will always be like this. We will practice certain things and do something the first time and be like, oh, that wasn't so bad. But I do think that as a nurse, you kind of have to grow a thick skin. I was like, why do I have to change when the reason that I'm the way that I am makes me better at what I do? Because patients need empathy. And if that empathy is taken away by me growing a thicker skin, then what was the point of the whole exercise in the first place? Like, why did I even become a nurse? Like that's
what has lacked in my experience is empathy. It has been a human connection. I have gone to several doctors who I have shared about my pain and issues with monthly cycles and periods. And I have been scoffed off and I have been misunderstood and I've suffered for decades because of. There's so many people in the world that go through this.
Being a nurse is not poking people and giving them drugs. Literally, a robot can do that. It's the whole other aspect of understanding someone's in the hospital in the worst point of their life. And like, you have to care about that.
How, as a nurse, do you feel that this can change both for patient and for medical staff?
I feel like it's a multifaceted issue. There's a whole conversation about like universal healthcare, right? But just at the base of it, even just like making people pay exorbitant amount of money for this stuff just to stay alive. Like you can go to a shelter and get food. You cannot go to a shelter and say, hey, I have no money, I need insulin. it doesn't exist. That's problem, big A, right in your face. Outside of that, I think it's just the mentality that everybody's on their own and you kind of have to be in charge of your own problems when human beings don't thrive that way. So to act in a capitalistic society, like everybody has to get themselves up by their bootstraps, and that's the only way to get respect, it breaks my brain. Like, I went through nursing school and it was taught. It was in your face that empathy was at the core of it. There's not a lot of feedback mechanisms in my hospital to really make me feel like I'm doing anything better or worse than anyone else. Like, I do what I'm supposed to in the eyes of nursing license, right? Like, I have to do what I have to do to get that care to them in the very base of it all, right? But beyond that, there is no measurement for whether or not my empathy for that patient is subpar, par, or better than par. All I have is the feedback that patients give me when I'm talking to them. And I have had so many of them tell me just reassuring things that my care and the empathy in my care is really what's making the difference.
Every day there's a ripple effect. Every person you encounter, there's a ripple effect. This is why these conversations, I think, are so important.
Okay, friends, we're going to pause there. I want to thank Channa Crespo for this candid conversation and for all of you listening. Please come back next week for a continuation of this conversation, and please keep going. Love ya!